Dear students, in this video I am going to talk about the leadership skills in medicine. This is a part of your foundation course. We usually talk about this leadership skill during the foundation course. So from this picture it is evident who are they. We can see Mr. Virat Kohli, Mr. MS Dhoni, Mr. Saurabh Ganguly, and we know that they remained the captain of Indian cricket team. So they were the leaders. But in reality, every one of us is a latent leader and potent leader. But what is the difference? But this potentiality does not transformed into kinetics, and real leader and leadership does not surface. We all are leaders. We have the quality, but we have inculcated it in our system. But due to the lack of awareness, due to the lack of practice, we cannot become a proper leader. But we all of us has the quality of it. Now, what is leadership then? It is ultimately about creating a way for people for contributing to making something extraordinary to happen. So from this picture, we can see that leader is trying to pull the team members. He is trying to taking out the potentiality from the team members so that as a team they can succeed. So as a leader, we can see the Cristiano Ronaldo over here. Sometimes you have to fight alone. He is giving the goal, this marvelous goal by himself only. Okay. Sometimes you have to pass the ball to others, let the others to give the ball, but the ultimate result is your team is winning. So there is a difference between a boss and the leader. From this picture, it is very evident that boss is giving instructions, whereas leader is leading from the front. He is a part of it activity. So what are the basic differences? A boss dictates and orders, a leader asks and guides. A boss focuses on targets, a leader focuses on team and goals. Boss puts accountability on others. You have done this wrong. And a leader takes and teaches self accountability. Micromanages at work, whereas a leader trusts and gives the right amount of autonomy. A boss aims for credit, whereas a leader willingly gives the credit to others. So from this cartoon, we can see one person is saying this, giving this dialogue. From this dialogue, it is evident whether the person is a boss or a leader. He is saying that his farm is committed to diversity. So many people are there, and he had yes men, seamen, jarmen, women, darmen, heymen. That means different form of use yes men in different languages. So he prefers yes, the answer yes in each and every instruction given by him. So what is he? He is a boss, not a leader. Because boss always says I, leader says we. Boss inspires fear. Leader generates enthusiasm. Boss utilizes or uses people, whereas leader develops people. Boss commands and takes the credit, whereas leader asks and gives the credit to the team member. And a boss says, go and do the work, whereas a leader says, let's go. A leader shares the glory with the team and keep the pain within himself. Now, my dear students, you may ask, why are you teaching leadership in medicine? Why leadership matters in medicine? Because we are here to acquire knowledge, skill, some kind of empathy, and we want to treat. Okay, so how come this leadership becomes important? Because even in the role of Indian medical graduate, you can see there is C2, L2, and P. One C, C2 means one C is a clinician, another C is a communicator, L is a leader, another L is a lifelong learner, and P is a professional. So why this leadership skill has been incorporated into the role of an IMG? Because after doing your graduation or post graduation, when you are posted to a remote village or primary health center, is a picture of a primary health center you can see. So the doctor is standing in front, and behind him standing his team. Without the help of this team consists of the sisters, this team consists of Asha workers, Group D staff, Group C staff. Without him, he cannot run this primary healthcare center. So when you will be going to do the same duty in some rural areas of primary health center, so you have to be the leader. Similarly, in the operation theatre, can a surgeon do operation without the help of an assistant, anesthetist, or the sister of OT? Cannot, because it is a teamwork. Similarly, this is my department. We cannot teach, we cannot help the students in their practical, we cannot perform any kind of clinical tests. Okay, we cannot do the early clinical exposure without the help of my team, and without making a goal, discussing within ourselves, and ultimately happening doing the best thing by ourselves. So why this leadership is important in healthcare system? Because it enhances the patient safety and outcomes, it promotes teamwork and collaboration, it drives innovation and ethical practice, supports healthcare system and improvement. Suppose I have done a mistake, my colleague will point it out that it is not the right thing. Okay, so this will enhance the patient safety and outcome. So, what are the core qualities of a medical leader? He or she should have a vision and integrity. Emotional intelligence, what is that? I'll be telling later. Empathy and compassion, communication and decision making skills, positive attitude, and self confidence. Positive attitude is very important. Every time if some team member comes to you with new idea and you discourages him or her that it is not feasible, it is not possible, then also it will demoralize all the team members and you cannot improve the performance. Now, there are certain theories of leadership in medicine. Some important theories are transformational leadership, situational leadership, and the servant leadership. These three are most important. Among them, the first one is the transformational leadership. Suppose you are a leader, you always inspires other through sharing your vision. You encourages innovation. You empowers your junior staff and students. Okay, so this is a type of leadership. Okay, that is known as transformational leadership. Second point is you are inspiring your team members, but your team members, their quality is a bit different. So according to their nature, you have to change your instruction or your way of behavior. So in your team, you may have some persons. So first is D1 who have low competence. They are not very proficient, but they are highly committed. If you ask them to do something, they will give their life to do that. So for them, what should be your role? You should organize them and tell them how to do it, and you have to monitor whether they are performing it well or not. Second type of thing is very difficult. They have low competence and low commitment. They don't know, and then they don't want to do. So what will be your strategy? You should explain them, then consult others how to motivate them. Then comes the D3, where the persons are highly committed, but there may be high competency but low commitment. They are experts, but they are not interested. For them, you have to listen their views because they have the expertise in that subject. You have to encourage them, you have to facilitate them. And the D4, they are highly competent and highly committed as well. For them, you have to give the autonomy. You have to give them freedom to decide. Now, the second type of leadership is the servant leaders. I think you remember your parents. So they have given everything for you. They have made you the priority. So these are the servant leaders. Servant leaders style, it actually prioritizes the growth and well-being of others. It sees the leadership as an opportunity to serve others. These leaders shares power and control to drive the engagement, and it measures success through growth and development. They listens and understands. It is not about them, it is about the team. Now, what about the emotional intelligence that a leader should have? Self awareness, self regulation, motivation, empathy, and social skill. You have to be the role model. If you ask your team member to do something, but you yourself is not following that, then they will not follow you. Okay, so you have to be the role model. So emotional intelligence is also it is a predictor of effective clinical teamwork, and there may be conflict among the teams. There may be some problem of a team member. You have to listen to that problem. You have to empathize that, and you have to solve the conflict also. So that is known as emotional intelligence, and it will vary from conflict to conflict. You have to apply new innovative techniques to solve the problem. Now, communication skills is very, very important for a leader. And for that, it is not only about talking, giving instruction. It is about active listening and having feedback, non-verbal cues and empathy, clear and concise information exchange, and leading effective meetings and rounds. So, communication skill, which includes active listening, that you should remember always. Teamwork and collaborations, interprofessional collaborations with doctors, nurses, technicians, administrators, these are very important in the leadership in medicine. Now, why I am talking so much about that in the first year also, in the foundation course? Because you can see this is a project, this is a self-directed learning project. The students have made, you can say the difference between, they have made a poster between the difference of Barnard-Solier syndrome and Glanzmann's thrombasthenia. So I have made a team of say 20 students. Okay, and as a team they have made this poster. So when you have given such assignment, so you have to have such qualities, leadership quality as well as becoming a good team member quality in yourself. Okay, so these are the teams who are getting the prize is not all, but they have acted as a team. Some became leader, some became the worker. Okay, and there is if there is any conflict, they have solved it, and ultimately they have reached the goal. So from the very beginning of your career in the first year, when you are doing some project as a teamwork, you should have this leadership quality, and you should know how to become a good team member. So, leadership is also required in research and innovation. It promotes inquiry and curiosity, ethical conduct, and data transparency, leading multidisciplinary research teams. Gender and cultural diversity is very important in medical leadership. Suppose you are posted to a primary health center in a tribal area. Okay, so they have their own norms and regulations. They may resist if you ask their children to give the polio vaccine. So, in those conditions, they have their own cultural diversity. Okay, so you have to manage it, you have to solve the conflict, you have to gain the belief or trust from them. Okay, so these are also a quality of leader that you have to do when you are going to work in the community. So another important thing is leadership during crisis. Very common example is the recent COVID. So here we require, so what we normally do that we will not do during the crisis period. So adaptive leadership during emergency, rapid decision making, maintaining moral and safety. So these are the leadership changes that happens during crisis. But after so many discussions, I am asking the suggestion from the team members, I am taking their suggestions, I am making a target. The ultimate result, you can see that these two lines, they are not meeting with each other and they are quarreling with each other. Okay, so one is saying that I told you in this way it will go, another saying is, then ultimate result is it is a failure of leadership. So why a leader fails? Due to the poor interpersonal communication skill, lack of vision, inconsistency and accountability. If the leader is himself is absent from the project work, then nobody is going to work. Lack of knowledge, that is also important. You have to have a profound command on what you are going to do. Avoidance of conflict, some people are there, okay, I should be good to everyone, so I will not say anything. Lack of ethics and favoritism, all these cause the failure of leadership. Now, challenges in developing leadership in medicine, because we are so much focused in acquiring knowledge, skill, and empathy that we lack the formal training of this leadership. That is the cause. Time constraints in clinical setting, we have vast syllabus that we have to cover within a very small time, very little time. So that's why we do not get to practice this leadership skill. Resistance to change, that is also important. Need for mentorship and role models. If you see some role models in front of you, then it will be easier for you to acquire this leadership skill inside you. So how to avoid all these mistakes of poor communication, lack of ethics, favoritism? How can you do that? You have to set a target and work towards it. Manage your time. Develop negotiation skills and conflict resolution skills. Don't let your past successes become your failures. I have scored so much now, so many, so high rank in NEET. Okay, I have done so good in MBBS examination marks. So that is enough. Okay, so your past successes, that will not work when you are going to serve the people of a remote community. Evaluate and refine your interpersonal skill. First, think about yourself. Accountability of yourself is very important. You have to evaluate yourself and you have to refine throughout your lifetime. You have to refine your interpersonal skills. Now, strategies for leadership development, leadership training workshops that will help you, mentorship programs, reflective practice and feedback, and integrating leadership modules in medical curriculum. So, what is the future of medical leadership? We know that this is the age of digital era, artificial intelligence, digital health leadership, sustainable healthcare system, and patient advocacy and community leadership. These are the futures of medical leaderships. So, what is the take home message? Each one of us can become a leader. We need to have a vision, we have to create a plan, and we have to work towards it. Effective leaders inspire. A shared vision enables others to act and share their successes with their teams. Thank you.